10 tips for best ED practice. 1. Stay humble. Medical professionalism begins with humility. Recognition of limitations and openness to learning from mistakes contributes to improved patient care. Professional growth occurs through acknowledging areas for improvement and seeking continuous education. 2. Introduce yourself and let the patient know you're their doctor. Clear role identification establishes the foundation for the physician-patient relationship. Introduction with full name and title reduces patient anxiety and sets professional expectations. This practice supports patient autonomy and informed decision-making. 3. Sit down for conversations and truly listen. The physical act of sitting during patient interactions demonstrates engagement and attention. Research indicates patients perceive seated physicians spend more time with them compared to standing physicians, even when the duration is identical. Active listening includes maintaining eye contact and providing verbal acknowledgement. 4. Trust every patient, even those who may seem like drug seekers. A non-judgmental approach to patient care improves clinical outcomes. Assessment of pain and substance use requires objective evaluation without preconceptions. Documentation should reflect clinical observations rather than subjective judgments. 5. Value the input of nurses, EMTs, and paramedics. Emergency medical technicians, EMTs, and paramedics provide critical pre-hospital assessment and interventions. Nurses spend significant time with patients and develop detailed insights into their conditions. Their observations and recommendations merit careful consideration in clinical decision-making. 6. Follow up by reassessing the patient before discharge, transfer, or admission. Patient safety depends on thorough reassessment before major care transitions. This includes reviewing vital signs, medication responses, and overall clinical status. Documentation should reflect these reassessments and clinical reasoning. 7. Always ask if the patient has any questions. Creating space for patient questions improves outcomes and adherence to treatment plans. This practice reduces medical errors and increases patient satisfaction. Questions reveal areas requiring clarification or additional explanation. 8. Use simple language, aiming for an 8th grade level or below. Medical communication requires translation of complex concepts into accessible language. Examples include using high blood pressure instead of hypertension or heart attack instead of myocardial infarction. Clear communication reduces medical errors and improves treatment adherence. 9. Avoid dismissive phrases. Avoiding dismissive language maintains patient trust and engagement. Replace phrases like, "as I told you before," with "let me clarify," or "would you like me to explain that again?" This approach validates patient concerns and promotes understanding. 10. Be a compassionate and caring person. Professional development includes cultivation of empathy and emotional intelligence. This requires recognition of personal biases, stress management, and work-life balance to prevent burnout. Regular self-reflection and peer feedback support continuous improvement in patient care delivery.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.